Hello everyone, so welcome to another video. In this video, we'll talk about what are the major differences between NEET PG exam and the INICET exam, basically the two important exams that you guys give for PG entrances. Now, I'm very happy to welcome Dr. Aman, who is also my junior from AIMS Delhi and currently pursuing MD in Nuclear Medicine from AIMS Delhi. So welcome, Aman.
Thank you so much, Dr. Rishabh. So, without wasting your time, let's begin this. First thing is the difference in weightage
Yeah.
of the various subjects. So, while INICET is more first and second prof based, so 60% of the questions you can expect from first, second year, plus FMT, plus OBG, plus there are some topics of surgery, important
Topics.
topics of
Yeah.
surgery.
Whereas NEET PG in terms of weightage is more balanced paper, right? So you'll have equal weightage of first, second year and third, fourth year. Subjects like PSM, medicine, surgery, they'll have 20 questions each in NEET PG. Whereas PSMK in INICET you'll get 7-8 questions. Right? Surgery, there'll be specific questions, again 15 to 20 questions, but only specific topics. So in that way, it is sort of more balanced. And since we both are from AIMS, so we have sort of an insider knowledge also in this that the faculty's mindset and the administration mindset is also more focused on first and second year. Aman, if you recollect, the number of teachers and the way the teachers engage themselves with the students is much more in first and second year as compared to third and fourth year.
Right.
They are much more involved in academics, in student teaching. And that is why the weightage of first and second year will always be more in INICET.
Other thing is that even in the third and the fourth year, final year, over in AIMS, what happens is that if the examiner is expecting you to know the basics,
Exactly.
which
Yeah.
comes from the first and the second year.
Yeah,
So
exactly.
there are questions which you think are from the first and second year, but would have been made from some professor in some clinical subject as well.
And one more thing, Aman, I want to share that, AIMS may a major posting is your rural posting. And there the interns manage the emergency and the ward.
So those 3 months are the months in which I believe that we have learned most of our skills as a doctor.
And also, and hence in INICET, if you look at subjects like medicine, they'll have more questions from emergencies, from ECGs, from casualty based stuff, from instruments, from NG tube insertion, like stuff that any MBBS student or intern should know. And that is the basis of the exam pattern.
Right. Now, coming to the second important difference, that is INICET is more predictable and there will be even PYQs which will be as such repeated.
Yeah. So people say that PYQs are important. You have to know your PYQs. But in INICET, you have to master your PYQs. You can't go for this exam without doing your PYQs. And as Aman rightly mentioned, there will be some questions which were asked in, let's say, 2013, 14, 15. And they have now ad verbatim, come in 2024, 25.
So what I believe would be the case that INICET would have a question bank in which they keep on adding questions as they are updated, and then they make a custom test from this question bank altogether. Maybe that might be the case. I can never say for sure, but that is how it looks like, and that is why questions will get as such repeated. And the previous year topics, there's something about INICET that they're like, for example, these topics: emergencies, ECGs, acid base, new technologies, biochem practicals, ANAT, cadaver specimens, surgical specimens, instruments, OBG instruments, labor, CA, ovary, CA, vulva these days, in peds, general peds, milestones, neonato. Then these are something that they'll tend to repeat again and again.
These things will come out. These things are very, very specific to INICET. You cannot go into this exam without knowing these. Now, a whole list of important previous topics for INICET, I have done a video long back. And the good thing is that video is still valid. That's the beauty of INICET. So I'll pin that video in the comment section and the description of this video. You can check that video as well. Right now, what you will see in INICET is that the weightage of PSM questions is little less, and sometimes a lot of graphs or equations that might be asked in PSM or pharma might be a little higher level. But in NEET PG, you will see that it is sort of a more balanced paper. You will get around 15 to 20 questions from PSM. Bhar bhar ke पूछते हैं PSM, right? Unlike INICET, in which you get around 7 to 8 questions, and that too from biostats or epidemiology. right? Again, minors weightage is more in NEET PG. In fact, if you look at last year's INICET, they didn't
literally
ask,
any question
they
came
didn't
from.
ask minors. Yeah, 1-2 questions psyche, 1-2 questions ortho, ENT, ophtha, right? I mean, it was such a shame to do the recalls of these subjects. So, and NEET PG again will be a more balanced paper. So, and again, medicine. And this is something every senior says, and a lot of videos on YouTube also reiterate the same thing, that focusing too much on medicine for INICET is a waste of time.
Agree.
A lot of questions from medicine can be solved from your knowledge from Path Pharma Micro, barring emergencies, ECG, acid base, and a good test and discussion. I think that should suffice your medicine preparation for your INICET.
Right. And other point which I want to say, that over the past 4-5 years, there has been a convergence of both these exams in the type of exam they are. So earlier what used to happen is that NEET PG used to have more like single liners, and then all the ratta wale topics more asked. But now they are converging towards a similar pattern form. But these are the essential differences which will still remain today as well.
Yeah.
So if we have to summarize that these are this is like the triad which I'll hand over to Dr.
So
Rishabh.
in fact, this is the triad for INICET, right? Some people call it the 3 pillars. You can call it 3 pillars, 3 triads, whatever. So 60-40% first, second year OBG, FMT, surgery, 60%, 40% remaining subjects. You have to master your PYQs and the last 7-day revision, which is a game changer. These last 7 days revision, and I'll make a separate video on last 7-day revision, what it means. Because a lot of students think that last 7 days, you have to do GTs, question banks, and you're done.
That is not the case.
That is not the case. So in fact, and especially for those students, who have not been studying since 3rd year MBBS. I am, you are. We started a preparation in internship, and still we got into Central Institute in PG, right? So for students like us, in the last 7 days, what you need to do, that is very, very important. So we'll make a separate video for that. Please comment any queries that you have regarding your preparation in the comment section. We'll be happy to answer them.
Thank you so much for watching this. Please do like, share, and subscribe the channel.